The Biden administration announced last night sweeping vaccine mandates for federal workers, for federal contractors, and under the auspices of OSHA. This is the Safety and Health Administration, the Office of Safety, Health, and Administration in the federal government. This is the agency that says you must have proper ventilation for your workers in a pandemic. You must have other practices to maintain the safety and health of your employees. Well, they will issue another regulation, which is your employees, if you have a entity that is over 100 employees, must be vaccinated or must receive testing on a weekly basis. It's not so much a mandate for the private sector as much as it is an ultimatum on this regulation. Here is Joe Biden announcing this. In addition, there are other aspects of this. And here's Joe Biden.
We need to do more. This is not about freedom or personal choice. It's about protecting yourself and those around you, the people you work with, the people you care about, the people you love. My job as president is to protect all Americans. So tonight, I'm announcing that the Department of Labor is developing an emergency rule to require all employers with 100 or more employees that together employ over 80 million workers to ensure their workforces are fully vaccinated or show a negative test at least once a week. Some of the biggest companies are already requiring this. United Airlines, Disney, Tyson's Food, and even Fox News. The bottom line, we're going to protect vaccinated workers from unvaccinated coworkers. We're going to reduce the spread of COVID-19 by increasing the share of the workforce that is vaccinated in businesses all across America. My plan will extend the vaccination requirements that I previously issued in the healthcare field. Already, I've announced we'll be requiring vaccinations of all nursing home workers who treat patients on Medicare and Medicaid because I have that federal authority. Tonight, I'm using that same authority to expand that to cover those who work in hospitals, home health care facilities, or other medical facilities, a total of 17 million healthcare workers. If you're seeking care at a health facility, you should be able to know that the people treating you are vaccinated. Simple, straightforward, period. Next, I will sign an executive order that will now require all executive branch federal employees to be vaccinated, all. And I've signed another executive order that will require federal contractors to do the same. If you want to work with the federal government and do business with us, get vaccinated.
There it is. And pretty big news. And I can tell you, we'll talk more about this as the program goes on, but I can tell you that just even the healthcare stuff, personally, that is a big issue in my extended family. And I imagine that is the case for millions and millions of other Americans. This is a big deal, I think, both from a public health policy standpoint, and also I think what is really not, I think, appreciated. This is a big political move too for Joe Biden. What's your sense of this?
Yes, I think it's a huge political move. What you want to talk about the politics of it?
Well, broadly speaking, from a policy standpoint, I think it makes some sense, right? I mean, we're watching state by state where the vaccination rates are lower, go into crisis mode about their ICU. I think there's even more data than there was a couple of months ago that the vaccination, protects you from the Delta variant in terms of catching it, but also an enormous protection in terms of getting seriously ill. I mean, so from the public policy standpoint, I think it's pretty clear why you do this. But let's talk about the politics behind this.
Yeah. So it's interesting. So on the one hand, I think they resisted doing this as long as possible. They were hoping that that there would not be a surge. They were hoping, like the rest of us were, in the spring, that it was going to wane. We're going to have a hot girl summer. We're moving on with our lives and everything's opening up. That didn't happen. Thousands of people dying a day. And so on the one hand, they're pushed into this situation. But I do think actually there is an argument to be made that the politics work out for them. Now, they're certainly going to anger some segment of the population, and some segment of that population aligns with Democrats. So it'll be interesting to see if there's any reaction in the California recall. Like, let's see if any voters there get pissed at Democrats and come out and
well, wait a second.
Cast a protest vote.
Okay, so wait a second. The people that they piss off. You've got a Venn diagram, right, of people who would vote for Democrats. And we're not talking about intensity here. We're just talking about right. If someone could show up at their door and say, here's a ballot and please, I'm not going to leave until you vote. Mm-hmm. You got a Venn diagram, right? You get the circle of people who are going to vote for Democrats. You get the circle of people who are going to vote for Republicans. Do you think there's really any significant number of people who would vote for Democrats who would be mad about this mandate at this point?
I don't know. I wouldn't rule it out. I think it's possible. I think it's far outweighed by the number of people who are going to be excited and enthusiastic about it. And I think it's outweighed by the number of people on the Republican side who avoiding a vaccine has become part of their identity. Right. And we're going to be angry anyway. And so that was the other point that I was getting to, that the interesting politics here are that what this, and then the way he framed it also, like the way he framed his speech was aimed at.
Let's play this clip. We have this clip. This is where he does it, because I think there's two things that are going on here. I mean, there's one, this is a wedge issue in some respects, right? Because you've got 65 to 70% of the population who are already double vaccinated, 65%, and around the exact same number who are in favor of a mandate. I don't think it's much of a coincidence, right? But here's how he framed it. Here, play this clip.
My message to unvaccinated Americans is this: what more is there to wait for? What more do you need to see? We've made vaccinations free, safe, and convenient. The vaccine has FDA approval. Over 200 million Americans have gotten at least one shot. We've been patient, but our patience is wearing thin. And your refusal has cost all of us. So please do the right thing. But just don't take it from me. Listen to the voices of unvaccinated Americans who are lying in hospital beds.
All right, that's good. I think we get the point. I mean, because there he is saying something that I think probably 150 million Americans have said at one point or another, like almost word for word, right?
Right. What are you waiting for? Right. And he did not have to frame it that way. Like, there was an Obama-esque version of that speech that he could have given that would have used lots of passive voice and, tried to coax people into the light. He didn't do that. He's like, what are you waiting for? Like, you're messing this whole thing up for everybody else. Like, that's practically a quote.
Yeah.
And so there's a choice in framing it that way. And the political result of framing it that way is that you isolate this minority of people and you polarize the country around that minority. If all you do is watch cable news, you might think this is a 50-50 question, which the politics of isolating a question, a 50-50 question, are very different,
right, than
isolating a 70-30 or 80-20 or even 65-35 question. And Democrats very rarely take the opportunity to polarize around an issue where they're in the vast majority, and once you polarize it, then you also then trigger the most extreme voices. So this minority, half of whom have reasonable, skepticism and fear about the unknown, but then the other half who are just nutso, like identity-driven opponents, those are the ones who are going to be loudest. And so then the rest of the country, who's like, what are you waiting for, just sees them as that much nuttier, and they continue to become even more isolated. And then they continue to grow the majority. That would be the theory, at least.
Right. I mean, this is the functional equivalent of the Biden administration appointing Marjorie Taylor Greene as the majority leader in the House.
Right.
I mean,
or like Hillary getting Trump nominated.
Right. Well, yes. Right. I mean, that's the downside of this. And,
right.
And the Obama administration, Obama did that too. If you remember, in 2009, they touted Rush Limbaugh as the intellectual pillar of the Republican Party. I mean, you remember those first 6 months? I mean, Rush Limbaugh was the only Republican they would address almost on some level. So there's some times where it works and some times where it doesn't. And that's the thing about this, is that, which is tough to predict. And it makes it sort of a bold move by the Biden White House in the way that they approach this, because this seems like to me, it is more of a no-brainer if we are going into a general election as opposed to a midterm election, right? Because a midterm election is about enthusiasm. And the question is, are you making the anti-vaxxers, which the overlay, in my estimation, that Venn diagram, and I'm talking the anti-vaxxers, not the people who are saying it's been inconvenient, or I just haven't had the time, or I'm afraid to take off time from work, because this addresses that for a lot of those people, because there's the mandate comes with a mandate for employers to give people time off, paid time off to get vaccinated and to deal with the fallout from it, which I think is really important. But in terms of that anti-vaxxer group, they were already going to come out and vote against, in this midterm election. And maybe you've sealed a deal. I don't know that you've motivated pro-vaccination mandate people enough with this, but that's an attempt to do it, right? By not making it a passive thing, by saying, like, I'm protecting the grievance of the rest of us who are like, we want to get this thing over with, and you guys are out there saying, like, I don't know, ivermectin is the way, is the panacea or something.
Yeah, it gives them something to fight for. It gives that, because the complacency is the thing that creates all of these midterm backlashes after a party comes into power. Like the political science is kind of in on that. The majority party's voters are happy that their man is in the White House, and so they don't show up. Enough of them, like a 10% or what, a significant number, don't show up because they're good. We're fine. What do we need to? Right. What do we care? I'm busy. I got better things to do. The party that's out is angry that every single day is another microaggression, seeing this person in the White House, and so they get motivated to go out. And so this, I think, gives some motivation to the majority, like to Democrats, to go out and show that because they're pitted in this fight. What makes the political science not necessarily reliable going forward is that we're in such a tense time now, that everything is fraught and being fought out in a way that it wasn't before.
Right.
And so if this culture war, and it's a culture war, like he's polarizing it around culture. If this culture war is going to be decided at the midterms, then you can't ever rest on your laurels in a culture war. If it's all just politics or electoral politics and your party controls the White House, you can take it easy. But if it's an ongoing culture war, you've got to constantly keep coming out. And so that could have an influence on turnout, I think, in a way that this time benefits Democrats.
Yes. I mean, what's fascinating about this is, right, there's two big elements that we don't know. I mean, again, if the election was this November instead of a year from November, things obviously would be clear. But the Republicans are organizing around these anti-mask, like anti-mask and anti-vax. It's quite possible that because of this vaccine mandate, 6 months from now, to come out and say, like, I'm against masks, everybody will be like, well, yeah, but we're not wearing them anymore.
Right, cool, good. Yeah, me too.
The pandemic's mostly over now. And so
the variants are the variable.
Well, of course, that's exactly. Right. We don't know. And so it's possible, the thing that makes this both like a political weapon to wield and a good public policy could also make it a political weapon that sort of diffuses where the Republicans have placed all their eggs in the basket, right? Like they're not going to get the same sort of salience out of Joe Biden seems to be a fuddy-duddy. And we got to get really angry about this. All the anger is coming from the anti-mask anti-maskers and the anti-vaxxers. And if 6 to 8 months from now, the country is a lot like, let's say, New York in terms of what we're seeing or less. The Republicans it's going to be hard for them to find something to get angry about.
Right. Exactly. Because if everyone's against masking and everyone's against locking down in a time when you don't have to do it.
Right.
So if they're like, let's stop wearing masks, I'm against lockdowns, no more lockdowns. You're like, well, there is no lockdown. We're not wearing masks. I think that's exactly right. If that is the situation in November 2022, and let's say the pandemic eases because the variants burned out, Delta is like ticking downward right now. I mean, hopefully we're at the peak and it's coming down. They also might have timed it for now, so that they can, causally point to their intervention and say, look, here's the date, and you'll see these charts and they'll be disingenuous in some ways. Right. Like look at, like you can look now at the chart of January 20th inauguration. It's like the peak of the entire pandemic so far is like January 20th. Right. And as soon as Biden got in, he was able to drop it. But it's disingenuous to be like, look, Biden himself like dragged this down. But you'll see a little dot. Biden introduces vaccine mandate, and then you'll see Delta numbers coming down. If they stay down and flatten out, and then restrictions are lifted, I think you're right that the politics all militate toward him.
I imagine this time around, too, the Biden administration is going to be a little bit slower to roll out the mission accomplished banner because, one of the depressing things about this, by the time we got to July was like in May, it looked like it's going to be the summer of love. And it didn't work out that way. The other element that could be interesting to work into this is sort of like a little bit tangential, although, Jim Jordan, I think it was this week, hinted at this, is that, we're talking about negative partisanship driving driving people to the polls. Between now and the midterm, Donald Trump could be running for re-election, and that was then all of a sudden we get to almost like a rough facsimile of 2018, right, where you can vote against Donald Trump today before he even running by coming out and voting against him in the midterm.
It'll be the second time Democrats are rooting for Trump to run for president.
Well, yeah, exactly. Exactly.
But this time, there's no risk that he'll be elected in 2022.
Exactly.
So in their short-term interests, they're like, yeah, come on out. And I think the more that they polarize around these more extreme issues, the harder it does get for him, to win in 2024. But like we already saw them,
and this time too, I think there is you don't have to sell the idea to Democrats that Donald Trump can win.
Right.
Right. I mean, that was also a big factor. It wasn't just that they wanted Donald Trump to run. It was that they didn't think he could win. Yeah. And this time around, I think there would be a little more savvy about that. All right.
Like they were in 2020.
Right, exactly. Yeah. Folks, there's more of what you've just saw where that came from. That's if you hit the subscribe and like button. Thank you. Really, thank you.